Hello, everybody. Today is November the 20th, 2020, the year that continues on giving. We have some great news this week on the vaccine and also some information on new treatments. And unfortunately, we have some horrific news on how the virus is spreading in the US, and Europe is also bending the curve. Just as a reminder, it is my background is described on the trailer, the description of every video, and also in the About tab. I am not a doctor. I've been working in healthcare for 40 years, more on the business side. My objective is to be a reader digest. I don't make the news, I don't make the facts, I just report the facts in a way that hopefully is digestible and that you can be more educated and make informed decisions. So please stay healthy and enjoy Thanksgiving, and let's get the show going. Hello, this is the first video tonight on November the 20th, 2020. And I hope you're all doing well. As I've explained in the video, we have a lot to talk about this week. This is the epidemiology video. It's a tale of two cities. We have unfortunately a horrific winter that has started. It was predicted, and unfortunately it's happening. And you can see that Europe really exploded here and is puts a lot of restrictions in place, and we're going to spend a bit more time there, and it's really working. They really have turned the corner. Unfortunately, North America, which is mostly the US, has taken off, and there's no slowdown there. The US now has the 187,000 cases. It's the highest cases we have had. We are now reached the level of 1 million cases per week. We just passed 2,000 daily deaths. Remember, we're like around 700 like a couple of months ago, and over 253,000 deaths in the country. I'm going to talk a little bit in this video of several tools that you can use to see what your risk of exposure based on where you live, based on the zip code or the county. So you really want to see that, and I will post them on the YouTube description of the video. So please open that up. And we're also going to talk about collateral damages that's happening with cancer and burnout. Europe is doing a good job bending the curve, but look at their mortality. They have 4,500 daily deaths compared to the US. The US, unfortunately, is way up since I talked to you 2 weeks ago. The daily case has gone up by 73%. Daily deaths by 63%, and we don't want to see this. Hospitalization by 52%. And we're going to discuss the fact that several areas now are getting to be at capacity, which is a big worry, not only for COVID, but if you get anything else that you need to be hospitalized for. Do not miss the other video. It's a separate video. We're going to talk about the great news. There's a lot of good news there about the vaccines are working. There's some good news on antibodies and how long they last. Some concern about people smoking. And we're going to do a review on diagnostic and treatment. So do not miss that video. Okay, let's see what's happening in the world. The World Health Organization is reporting 56 million cases and 1.4 million deaths. And you can see clearly it's being led by Europe, which is in green, and unfortunately North America. If you think we don't talk about South America anymore, and Brazil and all of that, it's really the US and Europe that are the hotspots right now. Basically, 4 weeks ago, we were at 445,000 cases per day. We have now gone up to 621,000 cases per day in the world. So you can see there's absolutely no slowdown on the worldwide basis, and the deaths typically follow 4 to 5 weeks later. So that's kind of consistent there. US is number one. It will stay number one because India is controlling it. And so India doesn't look like it's going to pass us unless they have a second wave that hits them. And Brazil is also controlling it. So we're number one, and we're going to stay number one for a very, very long time. So what are we talking about? The daily confirmed case in the US has broken a new record of 185,000 cases. You can see we are straight up, and there's no slowdown in the curve. Europe took a lot of initiatives there. You can see Europe is clearly controlling it, so as India, and we'll spend a little bit more time on those countries there. Europe, you look at basically Belgium, which was really in trouble there, as well as the Czech Republic. Since they put all the measures in place, some of them are lockup, closing at 10 o'clock at night, curfew and all of that, it has dropped like a rocket. That is astonishing how quickly the results were. Protection and wearing masks, and in most of these countries, they shut down the bars and the restaurants after 10 o'clock at night. It's working. And I'm not saying we should close the US. I'm not saying this in any form or shape, but I think there are things we can do to mitigate the propagation of the risk. And we could learn from the Europeans what the things that works and don't work. There's an interesting study that showed there's a Spanish mutation going on. People are saying, well, what's going on? Why is there this big wave? And there's this mutation there in orange and blue, and you can see it's coming out of Spain, and it is now spreading across Europe, which means it probably will be coming in our directions there. It's already, some of 80% of some of the UK, the new infections in the UK and in Ireland and in other part of Europe. And it doesn't show that that mutation is more fatal, but it could be more contagious. Remember, we had this huge mutation from Germany in March that took over the world that was 5 to 10 times more contagious because it had more spike proteins, which is the one that attach to your ACE2 receptors, to basically get inside your body. So hotspots, US, we'll talk more about it straight up. Italy is bending the curve. France is also bending the curve. As you know, they had a big spike there. It was really bad for a while. Germany, bended, but there's a bit of a resurgence. So we'll have to see what happens in the coming weeks. And the UK is also flattening out, but all at very high level. The positivity rate is still extremely high. You can see that when you see numbers between 30 to 10%, which is where most of Europe is, it's really bad news. Look at the United States. It's that orange, that basically purple line here. We're also climbing straight up there. So unfortunately, whatever you predicted, that winter wave or tidal wave is really hitting everybody. To give you an idea, Belgium that used to be at over 800 new cases per million, like a month ago, and they went into pretty much a lockdown there, has dropped by half their infection rate, and it's not the level of the US. So these are great news. Serbia is having the outbreak at 733, and France is still struggling at a really high rate. So you can see the old Eastern European countries are being hit really hard. The mortality is bending. I mean, you expect as they're controlling the cases, you can see that did a massive drop there that you will see 2 to 3 weeks later, the beginning of the mortality drop. And that's great news because we had some really high mortality rate in Belgium and the Czech Republic, and you can see it's going in the right direction. So is Sweden abandoning the Swedish model? There's this interesting article in the Washington Post. And as you know, the Sweden in the past had this philosophy to say, hey, we're just going to do le laissez-faire. This is my little French twist. And we're just going to let it run in the herd immunity and try to protect the people of the age of 65 years old. And unfortunately, you can see compared to Norway and Finland on a per million basis there, so it's basically adjusted to the population there. They had a really bad wave in June, but now they really exploded. As a result of that, they have 20% positivity rate. So it is an outbreak stage there. They have 8 times a higher case per capita than Finland. You can see the delta here, and 3.5 times higher than Norway, which has similar population there. So Sweden now has put in place ban gathering over 8 people. A lot of the Europeans have put this ban on gathering size. In Belgium, for example, you can only meet 1 or 2 persons per week outside your household. The Prime Minister has told people don't have dinner out, don't have parties. And this is an interesting analysis that shows that if you look at the economic decline versus COVID deaths, clearly we know that Sweden was much higher than their neighborhood, like Norway, Finland, and Denmark. But look, the drop of economic was the same, but they had a significantly higher mortality. So again, I think it has been shown over and over again that there is not a direct correlation between letting the virus out and therefore you will have a lower economic decline. In reality, and this is the same thing we saw in 1918 with the Spanish flu, is people who have high mortality have a similar economic decline. And in fact, in 1918, they showed that they had a slower recovery. So overall, they had the worst economic outcome. So US, my God, how do you explain this? I mean, remember we were getting all excited in the summer. And look where we are. I mean, it's just unbelievable. 11.8 million cases, 254,000 deaths. Let's do a deep dive on this. This is the reality check. This is the time it takes to add 1 million cases in the US. It used to take around 20 days. Now we're doing it in 7 days. And the way we're going, it's going to be less than 7 days next week. So it's accelerating. It's going absolutely the wrong direction. So the New York Times had to create a new color, the deep purple there, because they were running out of purple. The whole US looked red. And so you can see the intensity is really that whole Midwest area there is really where it's really, really bad. In the last 2 weeks since I talked to you, we have gone up by 73%. The deaths have gone up by 63%, and we're starting to push the capability of the hospital system. So really, really concerning, because we have probably another 2 to 3 more months of the winter coming at us. So let's do some specific. We saw US going up by 67%, but look at some of those numbers there. In area with big population like Louisiana, Tennessee, Washington, Pennsylvania, it more than doubled. And since I talked to you 2 weeks ago. New Jersey, that's also worrisome, very high density, is over 100%. New York, unfortunately, too. So that's why they're starting to take a lot of restriction. You may have heard they're closing the school, I think, on Monday. California, this is a big surprise. We thought we were like nice and cozy here, and we pretty much also double. And you may have heard we have a curfew. We'll talk more about it. And unfortunately, Minnesota, Arizona, Oklahoma, Ohio. So pretty much you should expect wherever you are, there is an outbreak. It is in the community, and you have a chance of being exposed, and you really need, to be proactive. So this is what's really worrisome, the hospitalization rate. It's the highest hospitalization ever. It's worse than the spring. People are starting to set up, a tent and bed area there in convention centers and all of that, because they're starting to be at capacity. And the problem is not the beds, it's the hospital workers. We're running out of hospital workers. So this is what you don't want to see, the ICU bed. These are the most important bed, not only for COVID, but if you have an accident, if you have cancer, if you have a heart attack, if you have a stroke, you want to be able to have access to a hospital bed and get the best care you normally would get. And you look at this number, New Mexico, 93%, North Dakota, we'll talk a lot about them, 91%, they are basically in full crisis there. And you can see there a full massive outbreak. Look at the United States, that's 488 cases per million. And North Dakota there is, if I do my math right, roughly 5 times or 4.5 times that. And then you can see South Dakota, it's another one that's having a problem there. So all of these are in constraint. Normally you'd like to see a ICU at 67%. It's kind of what we're shooting for, in case there's a certain problem there in the local community. Midwest, the whole country is up, but look at the Midwest. It's just like straight to the moon. 36% increase in the last 7 days. The explosion is now, we are living it, and this is an analysis by counties, and they look at what is the highest incidence by counties based on populations there. And you can see that right now in November, 2,436 counties in the US basically have the highest peak ever. And and this is going up and up. So I suspect that December is going to be showing similar numbers. So another way to look at this is to look by state. And the same question is that what is the highest peak of the state? And you can see we're beating it every week. It's just going up and up. So there is really no safe place, honestly, there. This is a bit worrisome. The whole Northeast, which for a long, long time this summer was one of the best places in the country, is kind of spiking up again. So there is no safe place. I mean, you should just be careful where you are. How do we visualize 250,000 deaths? The Washington Post did an interesting analysis showing that if we take this whole northern west of the US there, and you basically wipe them all out, it's a massive hole in the US. That's the equivalent of 250,000 deaths. And so I know that we get so desensitized, but all the projections are saying we may get to over 400,000 by the time the winter is over. That will be a number. That is what happened in the soldiers who died in World War II. Now there are some worse projections there, that if we don't do anything, and if we continue to have a lack of coordination and lack of mask mandate there, that we may pass a number that may be very close to what happened during the Spanish flu. The Spanish flu was only 650,000 deaths in the US, just to give the perspective. So these are massive, massive numbers there. It's the third leading cause of death in the US. Interesting number. The president of the American Academy of Pediatrics basically announced that we have reached now 1 million children having COVID. So this whole idea that COVID is safe, it's just for the old people, they don't worry, they have to die anyway. Sorry, I shouldn't say that. Is not true. They do get the disease. That doesn't mean they have severe cases, but they also vectors. And it's probably underestimated because we know that 80% of the children below the age of 18 are asymptomatic, so very low level of symptoms. So that number could be significantly higher there. So colleges. Well, there's a New York Times just published today an analysis saying there's 321,000 cases in 1,700 colleges. There's 65 colleges that have over 100 cases. Some states like Florida have 16,000 cases, Ohio 15,000, Texas 26,000, and Wisconsin 13,000. And you can see this whole area there, which is, of course, where you see a lot of the colleges. Everything is lightening up. So, if your kids are coming back for Thanksgiving, please take, precautions. Mask wearing in public. Well, there's a correlation between the outbreak and the mask wearing in public. I mean, the country is really waking up to the fact we have to be protecting our citizens there, and mask is the most effective and the least destructive to the economy. And so you can see more and more states now are starting to put some mandate in place when you're in public. Now, the New York Times published an analysis showing the relationship between control measures and outbreaks. So people who have the tightest control measure, which is California, you can see that they have a little bit of a spike up, but it's nothing compared to the people who have the least amount of control. So clearly South Dakota, North Dakota, Iowa, all of that, where there's a refusal to basically put this mask mandate and other restrictions on bar and restaurants are kind of leading some of the spikes. So I really hope we can coordinate the efforts across the country. A very interesting analysis showing the containment measure. So to the right is more and to the left is fewer compared to the number of cases. And you can see there's a very strong correlation between the number of cases, which is on this axis here, and the fact that, if you have some restrictions. So clearly the area over here, California, Maine, New York, they have a lot of restrictions. Have the lowest case. Now, same thing is happening with hospitalization, which makes sense because typically hospitalization leads 3 to 4 weeks after the case arising. And you can see a very, very strong correlation between containment measure, and I'm not saying lockdown. Containment measure could be, closing indoor restaurants and bars, every area there that has a lot of crowded indoor traffic is what you're trying to control. So we are basically at the highest peak, and you can see the area here, which is when this country have the sea. So confirming the whole Midwest is lighting up like a rod. And then you still have the New York area there that hasn't reached the level they were in the spring, but unfortunately we see they're going back up again. So if you look at every state in the US as a separate country, how would we compare to the rest of the world? It's an interesting analysis that was done by the Daily Mail in the UK. And they showed that North Dakota, South Dakota, Iowa, Wyoming, Minnesota, Nebraska, Wisconsin, Montana, Illinois are the top countries in the world if they were a state as an independent country, i.e. we're leading the charge, not in just one state, but in multiple states. Montenegro has an outbreak, but it's a very small country there. But you can see in the list there, I mean, it's really sad because in the dark blue are most of American states. And compare this to France, which I've shown you earlier there, has a high rate. You can see that we have some really hot states there compared to some of the European. United States as a whole is 477, but look at the difference between the US and all those states. It's 2 to 3x or 4x higher. So clearly major outbreaks. As a result of that, we got to talk more about mortality. I have to bring this up again. Typical flu is 42,000 per year. COVID-19 is 250,000. This is not the flu. This is a very, very nasty pandemic. Compare this to cancer. Cancer is the number one leading cause of death. And you can see, we are 250,000. We may go higher than that, on an annual basis. So let's look at the death. Again, if we look at every state as a separate country, and we normalize this per million for the last 7 days, you can see that unfortunately we are not great. We know Belgium and Czechoslovakia were one of the highest ones, but North Dakota is not number one. It has passed Belgium, which is good since I'm from Belgium. We'd like to get somebody else to be number one, and so is South Dakota. In Wisconsin, Montana, Illinois, all very, very high. And so really, really worrisome. So, whoops, sorry, going backwards. So this is a very good tool. I will put the link on the YouTube description. This is an area there where you can basically zoom in to your county, and you can basically experiment and you could look to see what is your chance of being exposed if there is 10 people, 15, 25, 50 people there. Clearly above 50, you're pretty much at high risk. So, and then you can see based on the color. So what you can do is zoom in. So I just picked North Dakota and South Dakota there. So if you have a group, in this case, I picked 10 people. 10 people, we all thought that will be safe. So if you put 10 people there in North Dakota, you have an 85% chance of being exposed. That is how prevalent it is in those hot area there. So it's really important that you really stay on top of what's happening in where you live, not in the state, not in the country, but in the county. This is real time. It gets updated on an ongoing basis there. So I just, picked it up today yesterday. And so please take a look where you're going, especially with the holiday coming, and take appropriate action based on the prevalence in where you are. This is an amazing story that I think hit the news. This is Jody Doring, who is an ER nurse in South Dakota, and she was just amazed that you have these people who are dying of COVID and who absolutely still are in denial they have COVID, basically begging her to do additional diagnostic because COVID is a hoax. Please, 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 it is a serious virus. Please take appropriate action. So California, we thought we were cool. We were kind of the darling of the U.S., and unfortunately, we're getting whacked like everybody else. And you can see we are going straight back up. It's a similar type of curve. We have gone, if you remember, from 2.7 maybe a month ago to 5.2% positivity rate. So it's not more testing. It is clearly a pandemic that is spreading in the community there. You can see the tiny bit of increase of mortality, but remember, there's a good 3 to 4 weeks delay. And so the worry behind it is hospitalization is up by 61%, and we don't really want to see that. Daily cases up 52% in a week. Mortality, unfortunately, is tied to that, so it's 51%. This is where our positivity rate has doubled in the last 3 weeks. Santa Clara has just announced that they're going to be at capacity in 3 weeks. 60% of the hospital's beds are occupied by the Latinos population there, while they're only 25% of the population there. So it's the low income and people who have to live in high density and crowded area there, and probably essential workers. So nobody's safe. Please be careful. So to give you an idea how we're doing versus the US, you can see the US case rate has taken off from around 10, which was like in September, per 100,000 people to 49 and still climbing. Per 100,000, the California is probably half the rate of the average of the US, but we don't like that curve. You can see that curve is very similar there. And unfortunately, the virus travels in airplanes and cars, so it's clearly going across state borders. So it's a bit of a busy slide, but the takeaway there, an analysis they have done in the past, it takes roughly 20 days between the fact that you see an increase in hospitalization and the increase in death rate. And that has dropped to 11 days. So I don't know if it's because people are going to hospitals later. I don't fully understand that. But you can see that, you can see why the governor of California has announced a non-essential curfew effective on Saturday, tomorrow, November the 21st, for all the purple tier counties in California, which is roughly 94% of the population. Now, it's a non-essential curfew, which means it's still okay to basically, if you're just with the same people in the household, to be driving out, if you're shopping for food, if you're getting some takeout, or if you're walking your dogs. Of course, I'm not too sure you want to walk your dogs at 10 o'clock at night because it's cold, but another very good tool, and it's across the country. and I will again put that link on YouTube, is you can now enter your zip code and you can look at the prevalence in your zip code area there. So it's even beyond the counties there. You look at the number of cases, the number of deaths, the infection rate. You can see Santa Clara had a lower infection rate than California as a whole. So again, I think one of the key things we discussed 2 weeks ago, be aware of the prevalence of where you are, be aware of the humidity and the temperature. We'll talk about in the second video today. And that should drive the amount of protection you have to, to basically follow to be safe. So changing a little bit the subject there, the healthcare workers are burned out. I mean, they went through a couple of tidal waves now, and they're just looking at these massive things coming at them. And unfortunately, they're very frustrated. And I've talked to several physicians and nurses. They're all telling me the same thing. The amount of frustration is that no one is listening to us. They are seeing so many deaths, more deaths than they've seen in their whole professional life in a period of a few months. They're exhausted physically, mentally. They really think that people are not willing to wear a mask and it's putting them at risk. And so there's a lot of, I wouldn't say anger, but just sadness. People are working up to 36 hours a shift. There is a big problem in the Midwest and the West where they're totally overwhelmed. There's not enough healthcare workers. These people are being flying or driven, hundreds of miles away to find them hospital beds. And then North Dakota is running out of healthcare workers, so it's allowing positive, so i.e. contagious healthcare worker to work if they're asymptomatic. That's as bad as we can expect. So a hospital adding more bed, but there is not enough clinicians there. Médecins Sans Frontières, which is an international organization that goes to countries when they have an outbreak, is now flying doctors to the US to help us. But Iowa is out of staff bed, but the bar and the restaurant are still open. So there's still a lot of strange behaviors. We are running out of PPEs again, especially not the hospitals. The hospitals have done a good job, piling up. But the smaller clinic, the nursing home, and the long-term care facility having problem getting N95 and protective gears. To give you an idea, an ICU nurse that basically takes care of a COVID patient, you normally have a 2-to-1 ratio, so it's 2 patients for one. Very often it's so intense with all the protection there, they can only do one-on-one, and the average length of stay is 3 times longer. Typically, hospital stays is 4.5 days, and a patient in the ICU with COVID can stay up to 28 days. And I think there's a big concern that there was a lot of delay of care, and so everybody was should have been tested for cancer or heart problems there is now finally coming there, so they're getting that wave there of non-COVID patients there who are sicker. To give you an idea, McKinsey, a very big consulting firm, did a report that just came out, and they say 43% of the physicians basically think they are burned out. Some of them have to live in RVs or in their garage to protect their family, which you can do maybe for a few weeks, but not for months. They're really frustrated because the PPE is a barrier to personally interact with the patient. I mean, the only thing the patient sees is barely your eyes. I mean, everything else is protected there. It's really hard to provide the human care and the love. And they're all reporting a massive amount of delaying of necessary care. So I'll talk a little bit more about that. So if you look at cancer diagnostic there has been a drop of 46%. Breast is like 52%, lungs is 36%. So by the time people finally go see a doctor, they're much more in advanced stage of the cancer where they could have been treated and maybe saved earlier there, but now they're at much later stage. Ironically, a similar problem with people who have diabetes monitoring, which is usually done at home. There's a 66% drop in the number of hemoglobin A1C tests, which gives you some idea of what's happening with your diabetes there. So this is just some example. Cancer screening, massive drop. This is a study from JAMA that just been published there on 278,000 patients there, that in the top 6 cancers, there was a drop of 46%. They expect as a result of that, the equivalent of 34,000 cancer there that should not have happened just because these people are delayed being diagnosed and treated there. And breast 52%, and pancreatic, which is so fatal, 25%. And so please continue screening. Mental health crisis, is everywhere, not only is it the healthcare worker, but I think half the country right now, between the election, COVID, California had all the wildfires and everything else. I think we're all mentally burned out. Half the country is clinically depressed. A lot of people have problem with insomnia and anxiety there. The good news is taking the stigma away, and most people, the employers and the providers, are now proactively reaching out to people with a simple tool like Calm and Headspace for meditation, calming, all the way to telehealth, to really help people manage the stress. As a result of that, the amount of illegal drugs and overdose have gone straight up. Unfortunately, opioids, you can see, has gone up drastically there, as well as amphetamine, close to double there. And unfortunately, a combination of social isolation, job loss, financial stress, people are having a really hard time coping. So please keep an eye on your loved one for any symptoms where you could proactively do something and help them. And then what about us, the rest of us? Well, HBS, Harvard Business School, did a study on 3 million people. And it turns out we're working more. Surprise, you probably have figured this out. Because we're stretching, we're working, most of us from home, we now spend an extra 48 minutes per day. So, probably a good 9 hours now is kind of the average there. 16% of us really like working from home, and we're planning to continue to work in some form or shape. And this is interesting. We have more meeting and less FaceTime. So we're getting more and more efficient and not, talking too much. We all zoomed out, I think, by the end of the day. We start to get bigger meetings there, as opposed to just one-on-one. And I also want to wish you a happy Thanksgiving. Please enjoy the turkey and make sure you wear your mask. And please be safe. If you remember, I have this second video that basically is going to start called the clinical update. You don't want to miss that. There's a lot of great news after this horrible bad news that I just had to share with you. So be safe, and please check my clinical video.